Hello, my name is Aaron Brzezinski, and I have created a brochure all about oxycodone. We'll start here to the right and then continue to the next slide. On the first inside page of this brochure, we're going to talk about what is oxycodone and how does it work. Oxycodone is an opioid commonly prescribed to treat moderate to severe pain. It's particularly useful following surgery, injury, or in managing chronic conditions such as cancer or arthritis or common back pain. How does it work? Oxycodone works by binding to opioid receptors in the brain. In binding to those opioid receptors, it blocks pain signals and can create feelings of relaxation and euphoria. This mechanism of action is why oxycodone is so effective, but also why it has such a high potential for abuse. Oxycodone is a synthesized opioid. Other opioids include morphine, heroin, and codeine, all of which are highly addictive substances. And according to the Salem Press Encyclopedia of Health, oxycodone was first synthesized and developed as an intended non-addictive substitute for those other opioids. Next, we'll talk about the benefits and the dangers of oxycodone, with the key benefit of oxycodone being its ability to relieve severe pain, as mentioned before. This allows patients to recover more comfortably after surgery or manage chronic conditions more effectively. Oxycodone is still prescribed often because it is such an effective pain reliever. But it's not without its dangers. Dangers of oxycodone include the significant risks of prolonged use, which can lead to addiction and dependence. Overdosing on oxycodone can cause life-threatening respiratory depression, and stopping the drug abruptly can lead to painful withdrawal symptoms. It should be known that even when used as intended, oxycodone can still have the following common side effects: drowsiness, constipation, nausea, more severe reactions like respiratory depression, as mentioned before, especially if the drug is being abused or used in unusually high doses, dry mouth, itching, amongst others. Because oxycodone is highly addictive, it is classified as a Schedule II controlled substance due to its high potential for abuse. Abuse of prescription drugs often occurs when dosages are not adhered to and when the drug is administered by alternative means than intended, including crushing, chewing, snorting, or injecting in order to make the experience a quicker and more intense high. Chronic misuse leads to addiction, overdose, and death, or in the case of recovery, can also lead you through extended periods of withdrawal. Brand names and street names are important to know when it comes to oxycodone, so that way you know what medications you're taking and what drugs you may come in contact with. It's not uncommon for someone who has been prescribed oxycodone to build a tolerance to the drug and then seek out a higher dosage from illegal means such as street drugs. These street drugs may go by Oxy, Ox, Blue, Hillbilly Heroin, Perks, or the other brand names of Percocet, Percodan, Endocet, and Roxycet. With the prevalence of oxycodone and the ongoing opioid epidemic in the United States, it's important to recognize the signs of addiction and to be educated on addiction treatment, recovery, and preventative measures. Some of these preventative measures include counseling and therapy, including cognitive behavior therapy, contingency management, and support groups. And before we finish, I would like to talk about safety and overdose prevention. You never know when the situation will arise that you encounter somebody experiencing an overdose. So it's important to be properly trained and prepared for those situations. Resources for those trainings can be found at Baltimore County, Maryland government websites or by calling the hotline linked below.